for at least 30 seconds, then your hands will be cleaner than clean, I reckon. Sing this song while you wash your hands. Come on, everybody, as loud as you can to wash your hands.
Good day, Mr. Nemangani. I'm Clint Fontaine, and we are a group of first-year medical students. Today, we'd like to perform a respiratory exam on you. This exam would include inspecting, feeling, and listening for abnormalities on your chest and back. You'd also have to be exposed from the waist up. Is that okay with you?
Yeah.
As you can see, the patient is at a 45-degree angle. There's good lighting, and he is exposed from the waist up. In this respiratory exam, the landmarks we'd be using include the suprasternal notch, the supraclavicular fossa, the left and right, the left and right clavicles, the left and right midclavicular line, the angle of Louis, the second intercostal space, the left and right anterior axillary line, left and right mid axillary line, and left and right posterior axillary line, and the xiphoid process.
Good morning, Mr. Nemangani. My name is Arti. I'm a first-year medical student. I'll be performing your anterior inspection today. So first, we can tell that the patient is not in any respiratory distress. There is no alar flaring, and there is no grunting, wheezing, or stridor at his mouth. He's also not using his accessory muscles to aid his breathing. Can you look up for me, please? There is no yellow discoloration of his sclera, which would indicate jaundice, and there is also no pallor and plethora of his conjunctiva, which would indicate anemia or an excess of blood. Could you open your mouth for me, please? There is no blue discoloration of his tongue, which would be an indication of central cyanosis. Could you lift your hand up for me, please? Okay. There is no nicotine staining on his fingertips, so I can tell that the patient is not a smoker. There is also no blue discoloration, which indicates that peripheral cyanosis is absent. Could you please put your fingertips together like this for me, please? Okay, I can tell that there is a clear diamond shape between his fingertips, the nail beds of his fingertips, so there is no clubbing present. Okay, so examining his skin, I can tell that it is a normal color, and there are no abnormal skin scars, lesions, or masses. The shape of his chest is also normal. It is twice as wide as it is deep, and it is not pigeon barrel or funnel shaped. I will now be assessing the symmetry of his respiratory movements. First, I will stand behind him and look at his clavicles. So could you please breathe deeply for me through your mouth? Okay, watching his clavicles, I can tell that his left and right lobes of his lung expand and collapse symmetrically and equally. Looking at the lower lobes of his lungs, I can also tell that they are expanding and collapsing equally, so the symmetry of his lungs are normal. I will now be taking his respiratory and heart rate. Okay, his respiratory rate is 15 breaths per minute, which falls between the normal range of 12 to 18 breaths per minute. His heart rate is also 65 beats per minute, which is also normal. Thank you.
Good morning, Mr. Nemangani. My name is Altanna and I'm a first-year medical student. Would you mind if I did the posterior inspection on you?
I do not mind.
Okay, so we can see by looking at him that he has no discoloration on his back and that his skin tone is normal. There are no lesions or scars indicating that he's had a previous operation, and his spine is central to his back.
Good morning, Mr. Nemangani. My name is Sinai Swat. I would like to ask permission to do an examination of your trachea by inspection and palpation. Is that okay?
Yes.
Okay. first I will inspect to see if the trachea is centrally situated, and it is, which is normal. Now for the palpation. I will place my index and my ring fingers on your clavicular heads and gently slide my middle finger to the area where the cricoid cartilage is palpable. Now I will slide my middle finger to the left and the right side between the area of the sternocleidomastoid muscle and the trachea, as well as on the other side. The area between the trachea and the sternocleidomastoid muscle is equal on both sides, which means the trachea is centrally situated, which is normal. Chest expansion by palpation. I will place my thumbs on the zippy sternum and my hands over the lateral aspect of your chest. Now will you please breathe in deeply for me? My thumbs are parting more than 5 centimeters, which is normal, and they are also parting symmetrically. Breathe in deeply. My thumbs are also parting about 5 centimeters and also symmetrically, which means chest expansion is normal. Thank you.
Good morning, Mr. Nemongani. My name is Murray. I'm a first-year medical student, and I would like to perform a vocal fremetus respiratory test on you today. Would that be all right?
Yeah.
Thank you. So when I place the palm of my hands over either side of your chest, I would like you to say the number 99 for me, please.
99. 99. 99. 99. 99. 99. 99.
The chest vibrations on Mr. Namangani's chest feel normal, and there's no signs of an increase in vocal fremetus.
Good morning, Mr. Nimangani. My name is Muhammad Abu Zaid. I'm a first-year medical student. May I please perform a respiratory percussion test on you today?
Yes.
The reason why I'm going to do a percussion test is to determine the structure of the underlying tissue. First, we've got 4 different types of sounds that we should expect. First, we'll have a resonant sound, such as which would be found in normal lungs. Then we'd have a hyperresonant, which we'd find in overinflated lungs, such as in emphysema. Then we've got dull sounds, which we'd expect to find over organs. Also, we've got stony dull, and that we'd find, for example, over liquid, and that would be in, for example, pleural effusion. We start in the left supraclavicular fossa. I then go to my suprasternal notch, move down, find my angle of Louis, move across, that's my second rib, I move below it, second rib space. And then move down, fourth intercostal space. I'll then percuss 2 regions in the middle axillary line. Okay, and that is my percussion test for today.
Hi, Mr. Nemangani. My name is Salama. I'm a first-year medical student, and I will be performing a respiratory percussion on your posterior chest area. Will that be okay with you?
Yes.
I'll first be using the C7, can you lean forward? The C7 as a landmark as I percuss along the interspaces where I will be expecting to hear resonant sounds from a normal and healthy body. So Mr. Namangani, can you lean forward and as well as cross your arms in front of you like this. This is done to move the scapula laterally away from the area in which I will be percussing as well as to avoid percussing the scapulae. Okay, so I will be percussing between the vertebral line as well as the scapular edges, as from the upper region to the lower region, comparing the right and the left side. Resonant, 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 resonant. I will be now moving to the mid and posterior axillary lines. Resonant, 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 resonant. Thank you, Mr. Namangani, and his body appears to be normal.
Good morning, Mr. Nemangani. My name is Daniel Daly. I'm a first-year medical student. Today, I'll be doing anterior auscultation on your chest to assess your breathing sounds. Is that okay with you? Yes. Can I please ask that every time I touch you with the stethoscope, that you please breathe in deeply through only your mouth? I could hear vesicular breathing, which can be described as a soft, low-pitched sound. Also, inhalation is longer than exhalation, and there's no gap between inhalation and exhalation. Intensity is also equal on both sides. This indicates that breathing is normal.
My name is Janelle Amrax, a first-year medical student. Can I ask your permission to do your posterior auscultation, Mr. Nemangani?
Yes.
Hug yourself and put your neck against your chest. All right. Can you inhale and exhale deeply and slowly with an open mouth each time I put my stethoscope on your back? Okay. I came to the conclusion that the patient had normal vesicular breathing. The intensity was the same on the left and the right side, and there were no evidence of any crepitations, crackles, or wheezing.
Good morning, Mr. Nemangane. My name is Jessica Mata. I'm a first-year medical student, and I'll be examining your vocal resonance today. This requires me to auscultate with my stethoscope over your chest and back, comparing left and right sides. Is that okay with you?
Yes.
Each time I place my stethoscope, please say the words 99.
99, 99, 99, 99, 99, 99, 99, 99.
Good.
99, 99, 99, 99, 99, 99, 99, 99.
Good vocal resonance was heard with appropriate intensity. This confirms what was observed during the vocal fremitus examination. There were no areas of increased resonance, which would have indicated areas of lung consolidation. In other words, Mr. Namangane seems healthy.